Well, Medicare fraud is big business, meaning that millions of our tax dollars are stolen by con artists or illegitimate businesses. And as our population becomes grayer, the dangers of Medicare fraud escalate. Joining me now is Pat McCall. She's a volunteer with the Alameda County Health Insurance Counseling and Advocacy Program, known as HICAP. And we also have Deborah Emrine. She is an FBI special agent, and she works in the area of preventing healthcare fraud and actually general health deception. Thank you, ladies, for being here. Now, as I just said, America is graying. More and more people are going to be going on to Medicare rolls. And now we're really beginning to hear more often in the news about Medicare fraud. Can I just ask you, Debbie, for the definition of that?
Of Medicare fraud? Mm-hmm. Medicare fraud encompasses so many things, but it basically has to do with the Medicare funding of health care, which means full government funding. Medicare is for seniors over 65 and certain people with certain illnesses. So when a beneficiary, as they're called, that carries Medicare insurance becomes a victim of fraud and it's medical related, then it's Medicare fraud.
Is it is it taking money from the federal government?
Yes, it is.
Right? Because the federal government is the one that's paying Medicare.
Medicare pays up to 80% of a health care claim.
Okay. And Pat, you're a volunteer, and you're specializing in giving seniors advice on Medicare fraud or how to handle their paperwork?
Right. I have two roles with the Alameda County HICAP, which is Health Insurance Counseling and Advocacy Program. One is talking to people to help them work their way through the choices they have to make with Medicare. And the other one is as Senior Medicare Patrol Alameda County Liaison. Every county has somebody who will answer queries to the 800 number as to potential fraud and try to investigate them and get the ball rolling before we can turn it over to Deborah and her team. Okay. And the Medicare fraud, as you mentioned, millions, it's really billions. Medicare pays out every year, according to my latest figures, about $860 billion in benefits for 45 million beneficiaries.
Wow.
The estimates for fraud go as high as 10%, which is $46 billion. And I did some thinking about that. I thought, well, how much is that? So I went and looked and got the dimensions of our currency, and $46 billion, if there were such a thing as a $100,000 bill, discontinued in 1929, it would be 16.5 feet tall. In other words, 2.5 times my height, which is 6 feet. So that's a lot of money.
And that money can be taking care of many of our social ills too.
Yes.
That's a lot of money.
That's a lot of money. And, you know, the thing that I wanted to be aware of is that that's money that we've paid into the system with our withholding over the years that our beneficiaries have a right to expect will be spent on health care.
Right.
And if somebody's defrauding them, I want that money back. I don't want that to happen to people.
So speaking as somebody who would be benefiting from that money, she wants it back. We all want the money back. So Debbie, what are some of the things that you encounter when we're talking about Medicare fraud? And we've heard stories about, you know, illegitimate insurance companies or maybe even an individual doctor's office that just kind of overbills or bills for services that he or she is not really providing.
Correct. Most commonly are upcoding and overbilling because some physicians feel they're owed money because Medicare doesn't pay enough of the claim.
Right.
And they're shortchanged and they can't run their business. So they'll tack on a couple extra claims or they'll upcode it to the next higher billing for the same treatment, but not the full treatment that they actually provided.
How can you find out if that's happening when, I mean, I'm sure it's happening multiple times across the country, but how do you find out about that?
It's difficult, almost impossible, and in some cases, it's medical opinions, whether the physician believes that they justifiably could have billed that code or not.
Okay.
That's difficult, but there are obvious billing issues when they bill for services absolutely not rendered.
When they do that, as a patient, would I see that on my bill?
Yes, you would. The problem, as she will explain, is that most seniors do not review their bill. They get a summary statement in the mail that spells everything out. And yes, there are instances when it's difficult to understand what that billing is in reference to. You may have to have a bit of medical knowledge to know. In those cases, I recommend that the seniors take their bill to their regular doctor and ask him to explain, is this what you did? And if it's a doctor they've been going to long term, he could look at it and understand, be able to explain to them what each billing code is for. Yes, I did that procedure. And the next physician that's listed on there, no, I never referred you to see this doctor. And no, I never referred you to have this blood work done. You might want to call Medicare. And explain to them.
So really, as the recipient, as the patient, we have to do diligence ourselves, and so we have to be aware of what's going on and be educated on that.
So if you have parents, look at their Medicare statements. If you are a senior and you don't have family that will look at it, or you don't speak English, there are so many advocacy programs out there in senior community centers and all around. Each county has their own advocacy program. There are so many ways for you to get help, to just review it, look at it. Take it to your doctor the next time you go to the doctor and say, excuse me, is this accurate?
And obviously, the reason why we want to do this, even though it might be a pain trying to understand that long list, is that it really will benefit us in the long run because we're saving money. We're getting our money back.
We're saving that money so that it can be used for medical care, not for fraudsters or for mistakes. I mean, the arena of fraud also covers abuse and human error. There can be, in your Medicare summary notice, it gets mailed to you every 3 months. In the Bay Area, it gets mailed by an outfit called Palmetto. So on the envelope that you get, it says Palmetto. You don't know who that company is. That's the administrator that mails those out. Don't throw it away. It's not junk mail. Don't throw away your Medicare summary notices. I just got my first one. I'm showing my age. But at any rate.
I don't know if I should say congratulations or not.
I know. I opened it up and I looked at it, and the first thing I saw was a doctor's name I didn't recognize. I never went to a doctor by that name. Well, the first thing I did was I called my insurance company, my retiree health care plan, and said, I don't know who this person is. I didn't call Medicare because I didn't need to. I got the insurance person to work in my behalf and said, check this. I did go to the doctor on this date. I never saw this doctor. I want to know what they say they did. And they verified that the coding was correct, that what I had seen the doctor for, and it was just the way they bill it to a practice. But I had to check it. I had to sit down and read it, and it's not simple to read it. So if you have trouble reading your Medicare summary notices, that's where HICAP can help.
Right, that's where a volunteer like yourself can come in.
I look at them all the time, so I'm used to spotting, okay, is this your Medicare number up here? And they code most of it, so not all of your Medicare number appears, because as you know, your Medicare number is your Social Security number with a letter. If it gets lost, you get identity theft. It's not good. So one of the things that we do when we talk to seniors in the community is to tell them, you guard your card. You don't take it with you in your purse all the time, or your wallet. Unless you're going to the doctor. You don't share that card with anybody. Somebody says to you, oh, I got a free service. It's such a deal. All we need is your Medicare number. First of all, your mother always said there's no such thing as a free lunch. And she was right.
Well, the thing is, and we're almost out of time, unfortunately, but the thing is really is that we have to be educated, as we're trying to let people know about that now, and then do our homework and pay attention. Right, because we are ultimately saving that money for ourselves. Because a lot of this money, once it's paid out, is gone. You can't recoup. People run off and they go away.
We have had some success in the last fiscal year. The additional funding that the Affordable Care Act put out for preventive measures and for recovery that Deborah's working on has resulted in recovering $4.1 billion. Now, that's not a whole lot, but it's better than nothing.
It's a whole lot, but
and it's 4 times as much as the year before.
That's a lot.
So that's a lot.
Ladies, well, unfortunately, we've run out of time, so Debbie, you have to come back. We have to talk about cases, okay? Because she's knee-deep into this stuff. All right, thank you very much.